Hello, this is Dr. Sam Henley with Active Life Chiropractic. Today I wanted to go over knee pain. Knee pain is something that I typically see a lot of with runners and other people that are very active. The knee is typically an area that we kind of have some issues with because it gets caught between the ankle and the hip. The knee doesn't have a whole lot of motion in of itself. It's a pretty stable joint. It only flexes and extends. However, if we have some hip issues or some ankle issues that have gone unnoticed, that can have a big effect on our knee. And like I said, especially with runners. That's the type of thing where when we get those people in our office, we do a comprehensive movement screen to really see where that issue is. Is it truly the knee? Is it ankle? What's going on? Is it maybe some muscular attachments that are getting inflamed? And that's the type of thing that typically with some chiropractic care and some exercises, we can get those people back to doing what they love, whether that be running or some other sport, and really get them feeling good and making sure that that knee doesn't become an issue in the future. Every once in a while there does become a point where the knee has had some injury, had some other problems, and that's the type of thing where we work with some other professionals and we'll refer out and co-manage cases like that. But it's always a good chance to see what we can do before we have to go that surgical route. Once we get to knee surgeries and things along that line, a lot of those surgeries, long recovery period, and it takes a while to bounce back. Some of the time is necessary, if you tear an ACL or something along those lines, it's very hard to do any conservative care to be preventative for that. However, a lot of times if we catch those people before they get injured, we can keep those injuries from ever occurring. And that's something, especially, I always preach that with my young girls that are athletes. That's something that we got to make sure we're doing the right strengthening exercises to make sure in the future they don't have the risk of ACL injury or hip injury. And that's the type of thing that I love to see those kind of patients in my office. If you ever have a question if that might be right for you, if there's something we can do to make sure we're keeping you out of a knee injury, we'd love to hear from you. And all our contact information will be in the description below. Thanks for watching.